Welcome to my banner with some 18 minutes up to 7, and I love this because we're talking about children. You all know that children are a gift from the Lord. They are a reward from Him. That's what the Bible says in Psalm 127, verse 3. So obviously, almost every parent wants to do what is best for their children. You know about the importance of car seats, baby gates, and other ways to keep them safe. But did you know that one of the best ways to protect your child is to make sure that they have all their vaccinations? Babies are born with protection against certain diseases because antibodies from their mothers are passed to them through the placenta. After birth, babies get the continued benefits of additional antibodies in breast milk, but the protection is temporary. Today, we're tackling all the weighing questions here on the show. To answer all of them, though, is Dr. Kwame Amponsah-Chiano. He is a public health physician specialist and also with the immunization program with the Ghana Health Service. So good morning, Doc. I'm grateful for your time.
Good morning, Mamavi.
Let's start. Second.
I'm happy to be here.
Good. I like that. Let's start with what's the schedule like for every baby once they are born with regards to vaccination?
Good morning to your viewers. And to your question, I want to believe that you're asking specifically to Ghana.
To Ghana, yes. Specifically to Ghana,
yes.
Yes.
6 weeks, 10 weeks, 14 weeks, and 9 months, and then 18 months.
Do you realize sometimes I kind of feel that we don't do everything?
Yes, we are aware that we don't get everything. I even forgot about the day you are born. It's also a schedule for you.
I've seen a parent who couldn't take the vaccination for the baby the day the baby was born because they talked about weight. Has weight got to do with vaccination?
Generally not, but then there are cases that, depending on the situation, they may differ.
Okay.
Yeah, but generally not.
So immediately when
you're... Even for preterm, it's the same schedule.
I've also noticed that you are combining the vaccines. Why is that?
Yeah, it will be difficult or it will be unethical for you to ask a parent to come every now and then. It's costly and also time wasting and all that. So for all the vaccines that can be combined, we do that. And these are usually tested before. Yes.
But you also do realize that these are babies.
Sure.
And sometimes you kind of feel for them.
Yeah, usually it's rather the parental distress or the health worker distress, as we call it. But for the baby, it may be distressing, but the end benefit is better. I mean, it's the end product is better than not giving them vaccines at all. So for example, as you rightly said, at 6 weeks we are combining 3 or say 4 vaccines because during the trials, that is how they were tested, and of course because there were no interactions, you could do that, and it saves time and cost. It saves a lot of time and cost.
Are the babies getting a lot more vaccines these days?
Obviously, yes.
So you keep introducing new ones?
Sure.
Why?
Because there are so many diseases, and as long as you have illnesses that can kill babies or get rid of people, you should have antidote to them. So there are millions and millions of diseases. There are hundreds of them that can be vaccine prevented. But we are only giving a few. Yes, because we don't have technology to, as it were, have antidote to all diseases.
So essentially what are you introducing to their young bodies?
Essentially, as in your intro, you mentioned that when babies are born, they have antibodies. Antibodies are like, I would say in general terms, I would say they are soldiers protecting your body from invading germs or enemies. So what we do is that we try to stimulate. In immunization, you try to stimulate more of the soldiers. And the soldiers are specialists in their own field. So for example, you have the Air Force tackling the air, the Navy tackling those that are coming from the sea and all that. So that is how the immunization program, not the program itself, but that is how the antibodies are produced. The antibodies are specialized. So, for example, you have specialized antibodies for measles. So when you have another disease coming, the measles antibodies or the measles soldiers cannot fight. So you need specialized antibodies. That is why we keep on introducing to specifically attack particular diseases.
Now, I realize also, when you have the schedule, the book, you realize that it's up to 5 years.
Sure.
How many parents actually do up to 5 years?
Actually, generally, immunization even goes beyond 5 years, but it's because of cost. And the nation will only sink money to help the most vulnerable because resources are limited, and that is why we peg it at 5 years. But even for the 5 years, it's usually within the first 2 years that is critical. Yeah, that is why most of the vaccines are given under one. There's only one vaccine in our schedule that is given beyond 1 year, and that is the measles second dose. But of course, if the child misses and you have the opportunity, you give before the child attains 5 years.
So you can miss. I mean, after 2 years, you don't strictly have to adhere.
No, by 2 years, it is expected that you've had all the vaccines. But at every opportunity, if the attending nurse or health worker realizes that you have made some vaccines, they will still give you before you attain 5
I think what continues to 5 is the vitamin E.
Sure.
Vitamin A.
And then also one of the most important things, because the program is, as it were, integrated, even though you are going for several services, you think that immunization is the only service you are going for, because you are doing growth monitoring as well. And that goes up to 5
I've got...
but for immunization, we think that by 2 years, you should have had all the vaccines.
How important is vitamin A?
Well, it is important. It protects. It also adds to the immunization by protecting you from diseases. And for example, it boosts the immune system. It prevents blindness, and then also prevents complications from diseases like measles. If you have vitamin A, measles will not, as it were, bring you down as compared to somebody who does not have.
But what I realize is that you cannot just walk into any hospital and say you want vitamin A.
You mean for a child?
For a child, yes.
Yeah, but if you have had it, then you don't need it, because it's given at a certain schedule, 6 monthly, starting from when the child is 6 months. Before the child attains 6 months, vitamin A is not necessary, because you get it. The child gets it from breast milk.
Okay, the reason I'm asking this, again, if you look at the schedule, you're supposed to go every 6 months, even when the child is 2 or more, till the child is 5.
Sure.
So can you skip any of those?
I wouldn't say you. Can you skip? Well, it's up to you, but then for the benefit of the child, you don't have to miss. You don't have to skip it, because it's been studied that 6 monthly schedules are the ultimate. Okay, and so if you miss it, the child may not benefit as much.
I don't know how much of complaints you get from the immunization centers. I've had to change a center because the nurses were not nice. And when you're dealing with children, the mothers are always very worried, and you need a nice environment. I mean, a happy environment, a comforting environment. Do you get complaints about centers?
But before I get to your question, but when you changed, were the other nurses nice?
Yes.
Yes. So for me, it's not that. I think it's more to do with the way people are brought up. That is what I think. But we do get complaints.
Because to change from Westlands to Jolu, I mean, that's quite a distance. Just because the Westland nurses are not nice, that's not good.
Wow. It's disheartening to hear that, but for us, as far as we are concerned, most of them are nice. But as you rightly asked, there are a few occasions that we hear of these
what do you do?
Nice people.
Because sometimes I feel like they feel they're doing you a favor.
Actually, it's not a favor that they are doing you, but if that is what they feel, then it's terrible. What you could have done, these vaccination sections work within systems. And in your case, I don't know where it is, but then there is a bigger center that you could have reported to.
Oh.
Yes. Because, you know, we work within districts or metros and municipals. And for every district or metro, you have what we call a sub-district. There are various structures. So probably where you went was just one outreach center. So there is a sub-district center or a sub-municipal or a sub-metro center that you could have reported.
And then, but when you get some of these complaints, what do you do?
You know, where I am working is just at the
that's
apex.
Yes.
Yes. So usually when we do, we relay the information back through the same system. So for example, if we hear it at the national level, we will go through the region. Because it's also not nice or wise, I mean, doing micromanagement. So we go through the region and then they will get back to the very low level.
Let me take you back to, you know, when the children are getting the injections.
Yeah.
Sometimes you feel that the child is too small for what you're giving them. I mean, as a parent, can I notify you, the nurse, that I think this is probably a bit too much?
Well, yes, you have every right to ask questions. But as far as we are concerned, so long as the child is born, the child is not too small for the schedules that you are giving, because it's been tried and tested over the years, even within our own country, our setting. So that's why initially in the intro I said that it's more of a parental distress or health worker distress in some cases, but not necessarily a problem. Yes, the benefits far outweigh the risks.
I think one of the very common things associated with it, especially when the child is like the 6 weeks, is the temperature.
Sure.
If you don't give the syrup, the paracetamol syrup at the right time, they sort of, and it happened to me with my first child. It was a very terrifying situation. Can you run us through, as a fresh mother, what do you have to do?
Okay, you're talking about adverse events. Yes, you know, the vaccines we give come in two forms. They are either live, the germs are live, or the germs are dead. So for the dead ones, the dead germs, you could give some subunit of it, I mean a portion of it, or some product of it. So there are several vaccines. The ones that most vaccines will give some form of fever, most vaccines, because what it's doing is that it's trying to mimic the presence of the actual germ that causes disease sometimes. And therefore, you know, when you have an infection, you tend to have this malaise kind of, I mean, fever and what we call the hot temperature, I mean, hot body, and the other things that go with it. In most cases, in other cases, the additives, you know, the immunization, I mean, the vaccines would have to be stabilized. So the stabilizers and some of the things that add on may also cause some kind of fever. So it is quite common. So when you get that as a young mother, what you need to do even before you get there is the health worker's responsibility to educate you on what some of the expectations are, and when you get them, what you have to do. My advice is that you get in touch with a very center that gave you the vaccine, that gave the child the vaccine, or the nearest health center or health outfit. They should be able to help you out.
Okay.
Yeah, but essentially, it's the health worker's responsibility to educate the young mother what the expectations should be.
I had a little plan, and I think usually they'll say, oh, give the syrup after. But my plan was to give it just before the vaccination. I don't know if it was in my head.
Yeah, maybe.
Was it just my head?
I think it was just in the head. Yeah.
But it worked.
That the child didn't get fever.
Yes.
Yeah. What about if you hadn't given it?
Okay.
The child may not have had fever. But when it happens, it has to be reported, no matter whether it is expected or not. It has to be reported. Has
a child died as a result of vaccination?
We have had reports, and usually what happens is that if a child dies and is say, attributed to the vaccine, it has to be investigated. And we work with the Food and Drugs Authority. They have the mandate to do what we call the adverse event following immunization surveillance, but we support them quite a lot. And so what happens is that there's a team of experts drawn from various disciplines in medicine and social science that sits and decide based on the information available and also information coming from, including pathologists, pediatricians, immunologists, public health specialists, epidemiologists, and so on and so forth, who would then decide whether this could have happened because of the immunization. The immunization is given at a time when children are also most vulnerable to diseases and ailments. So if you are also not careful, you think that even when there's coincidence, you may think that is because of the vaccine. But rarely do vaccines kill. Rarely.
But you haven't directly linked it to death in any particular case?
No, there have been, that's why I said there have been reports. I don't remember the exact ones, but then there have been reports, even in the literature, that some vaccines have caused, say, anaphylactic shock, which has led to death. You know, and it's quite rare, but if it happens to one person, of course, you cannot say it is rare. To that particular parent, it's quite disheartening. But that is the more reason why there's this system that tracks whether, I mean, AEFIs or what we call the adverse events following immunization. We track them and try to see whether the vaccines are causing more harm than benefits. But as of now, we do know that immunization is arguably the best, apart from water. It's only second to water in terms of public health impact. It's prevented millions of diseases, between 2 and 3 million per year.
Between what?
2 and 3 million, preventing 2 and 3 million deaths per year.
Even in our country?
Yes. No, I mean worldwide.
Okay.
And of course, we are part of it. So to answer your question, there have been cases, but not particularly here. I think there was one particular case that was attributed, but the fine, I mean, at the lower level, the notion was that it was due to the vaccine. But eventually, when it was investigated, it was not actually the vaccine.
I've got Kutsina Cyril asking a question on Facebook. He says, do you go to rural areas to immunize the children there? Because when people are chosen to do such work, they tend to focus only in the urban areas.
I think this is Cyril. Is that Cyril?
Yes.
Maybe you might be able to answer him. You should be able
I know
to do
that you are everywhere.
Everywhere.
But I think the question that the follow-up would be, are they open, you know, anytime you go? Okay, we have, you know, there are certain areas that are so remote. And because we have strategies of reaching out to the very remotest regions. We have what we call the static clinics, where, like, you've been going, it's always there. Maybe it's a facility, I don't know. It's a facility. So they're there a day in a week.
One day
in a week.
That's probably an outreach.
Oh, so that's an outreach.
Because for a facility, they provide immunization every day. If it's a health center or a hospital, it's every day.
My experience when I gave birth was you had to wait because, you know, you're on admission and they come on Fridays. Unless, I don't know how does it work?
They come on Fridays. Yes. What it means is that they are doing an outreach. But for a facility, we would expect that they give immunization every day. So if they are listening, then the policy is that for all for all health centers and hospitals, it is daily immunization. Except the outreach sessions where the nurses move from their, let me say, zone of comfort to the community. And that could be once a week or once a month.
Okay.
But back to what I was saying, the strategies. We also do the outreach, which I've just explained, apart from the static, where it's every day, and then the outreach. And then we do the camp out, for example, in the riverine areas, like the lakes, the islands on the Lake Volta, where they go there, we go and sleep over and finish everything, maybe within a week or two. do everything.
But are they welcoming? Because sometimes I get the feeling, oh, what are you introducing to my baby and that kind of thing? People won't be so open.
Yeah, there have been several studies, and even recently, quite recently, we did a study just to find out the acceptance of immunization. And in general in Ghana, mothers are always, and of course fathers as well, but it's mostly women who go there. They are always willing. The bottom line is that they think that once it's coming from health, it is a good thing. So we also try not to breach that trust. And
especially when you scare us with the polio and the malaria. Malaria kills in children very early if you don't take it.
Well,
those scary strategy.
Those messages are scary. Of course, I won't talk about malaria because we don't have a vaccine now currently. Maybe it's in the pipeline. But for polio, maybe you are old enough to have seen what happened. So sometimes we don't even have to tell you. You saw what happened, and then you've seen what is happening now. It's very rare. Since 2008, we haven't even reported any case of polio. That is a paralysis due to poliomyelitis. Measles used to be one of the leading causes of death. And since 2003, we've rarely reported any death. I don't think that we've even documented a death due to measles. But I understand that even before some of us entered medical school, measles used to be, I think, number 2 to malaria in the cause of death. So it's not just the message, but it was actual. I mean, it was real. So I wouldn't say that we try to scare you. We tell you what the situation is. Yeah.
When you do the national exercise, that's quite different from the scheduled ones.
Sure.
There's some kind of confusion in my mind. If my son was vaccinated, I mean, if we received a vaccine, a similar one, say polio, on a Friday, and there's a national exercise on Tuesday, what's the advice?
The advice is that everybody would have to be vaccinated.
So even though I took it on Friday,
yes.
I have to take it again on Tuesday?
Yes, it's only waste. Essentially, it's waste of money. There's no additional risk to the child. But it is also programmatically difficult to ask volunteers to select people who haven't been vaccinated. It's a difficult task to do. So essentially, we waste the vaccine.
Okay. But too much of it doesn't hurt.
No. You need a minimum of 15 doses. And if it is more, fine.
As in your lifetime?
For the child.
Okay.
For the child. Even adults need polio. But of course, we can't, resources are so limited that you can't cover everybody. So you cover the most vulnerable.
Oh, so those vaccinations we could also take?
Sure. All the vaccines that the kids take. So if you've traveled, sometimes the embassies insist that you take certain kinds of vaccines.
Yeah.
Of course, but the children have had it, so
So why don't we take it?
It's because we don't give you. Because it's so expensive, we can't afford. So when you are going to take it, you pay for it.
Who determines when we have a national vaccination exercise?
Okay, for some particular vaccines, it's determined by the WHO in conjunction with the countries, that the member states of WHO, the World Health Organization. For some other vaccines, it's a nation. For example, polio is earmarked for eradication. Okay, so when there is a case, say in Togo, and there is a response to it, Ghana is obviously part of it. I mean, by our nature, I mean, by the fact that we are so close. Because one case in Togo or one case in Nigeria is a case in Ghana as well. So we do what we call a synchronized vaccination exercise. That is what happens. Yes.
I'll come back to the issue of people agreeing because you work with volunteers, so find out how challenging that is. But if you're watching us and you've got a question, you can call us right now on 0302-211-69102, 0302-211-69102. We'll take some quick questions on this one. but how easy it is to get volunteers to want to do this exercise. I heard something that I'll share with you.
Yes. How easy? In many cases it is, but in other cases it could be difficult. For particular districts, it can sometimes be difficult. We don't pay them. Obviously,
At all.
What we give them is not payment. It's just a token for lunch.
Okay.
Yes, because it will be so difficult to get money to pay, because usually national immunization days, the exercise is very expensive and we get very little support, so you can pay them.
Who is funding the whole exercise?
Usually it's the government and WHO, the WHO and its member countries. So we get part funding from WHO, UNICEF, other partners, USAID, Rotary International has been fantastic, and then the government also supports.
A colleague shared this with me, that there are reports that sometimes the volunteers who carry the vaccines would just go and sit somewhere, dump it, be there for a while, and then bring the empty container back.
We've heard several stories, but these are isolated cases, very isolated cases, because mostly they do what is expected of them. Quite a few bad nuts do that. And I do not think it is because we don't pay them, because for many districts, almost 99% of them, they do it religiously. And they've been doing this, some have been volunteering for 20 years and over, and they do that religiously. It's only quite recent that because of the advent of these galamsey, these mining, small-scale mining, when sometimes they go for what they call by day, that is when they go and do this kind of menial jobs, they are paid better. And so usually when there is NID, a National Immunization Day against polio, for example, they ask for more. Unfortunately, we are unable to pay. And sometimes such districts have difficulty, have terrible times getting the volunteers to work. But without the volunteers, it will be virtually impossible to do it.
Should we continue not to pay them?
Well, if you can support us to pay them, why not? We would have loved to pay them, but we just don't have it. The resources are not enough to pay them. That is why we give them some form of lunch, as a token for lunch. And for most of the volunteers, they are fine with it, so long as we appreciate what they do. And a lot of them also, or should I say most of them, do know that they are supporting their community. And so they do that with all the happiness that they derive from.
There's also a concern of if the volunteers came to a school and they were told, oh, we have to inform the parents because we can't let the children take something without the parent not knowing ahead. So go and come back, they don't return.
Okay, for those ones, we don't usually encounter these. But once these things happen, the media is also a partner. So let the local people know, or whoever you think should be in the know, should get to know this, and then we will rectify that.
So when you find out your child is not growing up well, who do you talk to? If the child is not growing up the way that you think a child should?
You go for these regular outreach services or these vaccination centers where, as I said, you have integrated service. So you talk to the nurse in charge or whoever is attending to you. And then you may, as it were, as a parent, be thinking that the child is not growing well. But we have growth charts to guide us. When you're weighing the so-called weighing cards, your road to health, or what we call the child health records book, you have these graphs that guide us to see whether the child is not growing well. So sometimes you may be thinking that the child is not growing well, but so long as the child grows on its own centile chart, the child might
sometimes
be
that's a problem, because some of the nurses will make you feel like your child is not growing. If you don't know and you repeat the same weights,
what happens?
they will have a problem with you, because they feel, oh, the child should gain something each time you visit them.
Yes, that is what is expected. But what is expected of them also is that when the child is not doing well, then they would sit with you to identify why the child is probably not doing well and guide you to help the child, assist the child.
Should we always gain? Should we always gain each time we visit?
Sure, you should. If the child is not gaining weight, there might be a problem.
Really?
And more so when the child is crossing the central charts. If you see, if you've seen those cards before, see that there are lines. Yes. If a child is going along the line, then that is fine. But if a child starts crossing the line, then there's a problem. So that is what guides them to see whether the child is doing well or not. And when it happens, as I said, it may be nutritional, it may be that the child has had a recent illness, for which reason the child has dropped in weight. And so once they identify that, or if they are unable to do that, they refer you to the next higher level. We would assist you to that. But mostly it's about nutrition, the way the child is fed.
That seemed to be a big challenge.
It is.
How, I mean, how do you know what's the right thing to give the child?
Again, it's the nurses who should guide you, because they are, you know, for the first 6 months, it's expected that you give exclusive breastfeeding, but not everybody is able to do that, especially for working mothers and all that. So there are guidelines, and it's even on the card, the booklet, the various foods that should be given to the child at which point in time. You see that it's a lot of information, but not every mother or every parent can read. So the nurses are there to guide you, to support you, to see what is there. They are in pictorial forms as well, so that I can guide parents to feed the child well, in addition to the immunization and the vitamin A and all that. You need all that for a healthy baby and a healthy child.
Okay. All right. So back to, you have to follow the schedule.
Sure.
What is in the book is up to 5 years.
Sure.
Every 6 months you go for the vitamin A.
Sure.
You say if you can, don't skip it.
Yes, I would encourage you not to skip it as much as possible. But the point is that once people finish the immunization, they think that is the end, and then they tend not to go. But I will encourage you, because it helps. It helps you also to monitor the growth of the child, yes, which is very, very important. Sometimes that is the first point to pick whether the child has a disease or not.
The scale.
Sure.
Where you hang the child, would it ever change?
What does that mean? The question is not very clear.
Okay, I'm speaking to you like we're both in a center and we
are
watching.
That's fine. That's okay.
You know what they put the child, what they hang the child on.
Yeah, that's the
to check the weight.
Sure. It doesn't
I'm asking
change.
with a sack. You know, they're holding the baby like that in that sack, and the baby is hanging. You can't hold the baby until they finish. The baby has been stable enough for them to see the weights. I'm saying, would it change? Would we move away from that sack hanging?
Oh, what are your fears? Do you send your own sack? In
yes,
most cases, you have your own sack.
Yes, sack. Yes,
you get your
but
own
the child
sack.
is hanging.
So you are afraid that the child might fall. Oh, I get you. Okay. Well, the sack has to be inspected.
I've seen a more sophisticated, you know, which is like a tray, and then the baby is dropped in it.
That is for younger children.
Yes.
Usually, for very young children.
But when you go to the centers, even for babies, it doesn't matter how old you are, except for if you're 1 and above, where you stand on the scale.
Right.
You will be hanged.
And you are afraid of the child. Yeah, I mean, your fears are real, but I do think that they take precautions in case of a fall. Should there be a fall, they don't put anything under the sack.
No, I mean, they're cautious because they're standing close by.
Okay.
Exactly.
That's what
but I'm just saying that, can we move to that tray where you just put the baby just lies in the tray instead of always hanging the baby in the sack?
Yeah, I know of the tray, but I do not. I think that the tray also has a limit of weight, and that is why because the sack, the one that the dial one, has up to about 50 kilograms or so. I don't remember too well.
Okay.
But that is.
I'm just making an appeal. Let's move away from the sack hanging.
We'll look at it. We'll look at, but we haven't had so far. We haven't had any problems with the sack thing yet. Yeah, but as you said, I would investigate what your fears are, and then
I'm not saying there's a problem with it. I'm just saying that I think that we've developed enough to have what other people are having these days. Right. So that the child is not put in the sack and hang there just to check the weight. Okay. That's all I'm saying.
All right, well taken. I would take that across, but that is not part of immunization. But it's part of the same service delivery. So
that's the first thing they do before, because they check your weight. And then,
yeah, so once I have this information. I was also in a district some time back, and I know that this has been the tradition.
Yes.
So you've just drawn my attention to that. We'll look at the possibilities of whether we can get what you're saying and look at the benefits. I mean, as the risks and benefits of both.
But what's your greatest challenge now?
The biggest challenge now is equity, and also getting money to buy the vaccines. Is the greatest challenge.
Can you explain
equity in terms of getting to the remotest parts, as somebody was asking? You know, it's usually a challenge getting to a place like the island. We need boats. You need some incentives for the health workers who go and sleep over, sometimes for a week, for 2 weeks, sometimes they're open, even though they sell mosquito nets and all that, but there are no structures there. And even as of now, we have difficulties with transportation sometimes. What the hinterlands usually use are motorbikes, and we don't have them. We are trying to procure more, but then it's always a challenge. We never get enough resources to get them. Then also of late, we've been having problems getting the vaccines to give to the children. We know that the government is doing quite a lot, but the vaccines are expensive. So if you have any other partner who can support that, we would.
But I thought the WHO was helping.
Actually, most of the vaccines are procured by Gavi. It used to be the Global Alliance for Vaccines and Immunization. They were supporting about 80%, but that is quite huge. And even the 20% or say 10% that the government also supports is very, very, very huge. It's quite about close. In the next few years, 5-7 years, we are being weaned of support from partners, and so it's going to be the sole responsibility of government to purchase the vaccines, and we foresee that is going to be a huge challenge.
What would it mean?
What it means is that we're going to buy all the vaccines ourselves.
How much? I mean, I know that it's expensive,
millions,
but if you want to put a cost to it.
I don't have the cost now, but it should be in the area of about $50-60 million, and that is quite huge.
Have you been also exploring, okay, when we go, we pay? Except that the issue with that is a lot of parents will show up then.
Yeah, for now, immunization is free, and it forever remains so until the government says they should pay. It's the government that funds it, so once the government pays, it's free. So even what Gavi is paying is part of Ghana government money, more or less. It's a partner. They are partnering the government to pay for the immunization. So it's still Ghana government money.
Wow. I hope we don't get there.
Yes, we hope so. So that's why we are appealing that if we are other partners who could support purchase, because the vaccines are very expensive.
I'm told that we have challenges with the phone line, so sorry we are not able to pick your calls, but let me wrap up with some of the messages on Facebook. Francis Anochi says, enough education has gone into this immunization thing, and parents should not be too stubborn to respond to this call. Goes on and on and on. Prince Nuruddin says, this helps to protect, okay, you're talking about the importance of immunization. It helps to protect the young children against polio and elephantiasis. Is there a vaccine for that?
No. A lot of people confuse the mass drug administration and vaccination, because elephantiasis or the lymphatic filariasis, one of the strategies to control it is to periodically give some medications. And because it's en masse, sometimes people confuse that with immunization.
Okay. There's a nice suggestion here from Karim, who says parents should be fined for defaulting immunization.
No, I disagree. I think it's just the way we educate them to appreciate the importance, and also the fact that we've not been seeing the diseases that used to kill us some years back. Yes, particularly measles. I do not think you've ever seen measles before.
No.
But if you talk to your mother or your grandmother, they will tell you in Tobro was quite common.
Is it still, because they would say you will have it once in your lifetime or something of the sort? Is it true?
No, you don't have to have it. That is why we haven't seen it. And it's because, it's not just by chance. It's because of regular immunization. You need a certain minimum to be able to protect even those who are not protected, who haven't had the vaccine. Because once you get a certain minimum level of vaccination, then the germ is unable to move. You understand that?
Yeah.
Yes.
Have we done anything to chickenpox?
Not as a program, but chickenpox also has vaccines. Yes.
So that's why we don't see the children these days.
No, they do have chickenpox. Is there, but it's not only restricted to children. Adults do have it as well. But as I was saying, we do not have a program for chickenpox because generally we know that chickenpox doesn't kill, and obviously because it's expensive, you would want to sink your money to where you get the maximum benefit. But as and when you have some reason to, intervene, you do so, and you need data.
Yeah,
you need data to do that.
So finally, you realize that a lot of people buy the yellow card at the airports. They don't take it. They don't get the injection for yellow fever.
But that is dangerous to them themselves.
They buy the card at the airport.
Oh, you are telling me.
It's about 10 cities or 20 cities. What's the risk?
I would have to relay this information.
Oh, I'm sure you know about this.
No, because we do not handle those cards at the ports. Yes, but I work in immunization. The port is not part of immunization, even though they give immunization. They are not part of our setup. So this is news to me. But then I'll relay that information to
okay. So you could disguise yourself, any of your officers, and just get to the airport. You don't have the card. You're traveling.
But my caution to the traveling public is that they need the yellow fever vaccine. I have had it twice. But even now, you need only once, and it's for life.
Okay.
It used to be every 10 years, if you remember.
Yeah.
Yes. But now it's once.
Oh,
it's
really?
been
Since
proven
when?
that.
Because I've had one, I think last year.
Oh, there you are covered.
That's it.
Yes.
Okay.
And WHO has issued information to that effect, that you need just once, one time thing.
What's the effect of that if you don't take the vaccine?
If you don't take the vaccine, you are deceiving yourself. First of all, yellow fever is endemic in Ghana. There's a belt right from Senegal to Ethiopia that is the yellow fever belt, meaning it's endemic within those countries. And so if you are bitten by the mosquito that transmits yellow fever and you get a germ, yellow fever is not curable. It's not.
Niakofi Smatabe, did you hear that? Stop buying the card. Okay.
And this is from your own office?
No.
Okay.
I want to say thank you for your time, Dr. Kwame Omponsah-Achiano. He's a public health physician specialist. We've been talking about immunization with the immunization program, Ghana Health Service. It's been amazing. Thank you so much for your time.
Thank you too for having me.
Please stay with us. We've got more. Please stop buying the yellow fever cards.